Hello class, this is Emergency Care and Transportation of the Sick and Injured. This is Chapter 11, Principles of Pharmacology. After you complete this chapter, you will understand the significance and characteristics of general pharmacology and will be able to identify, describe, and demonstrate the steps for assisting and/or administering medications carried by EMTs. For National EMS Education Standard competencies, the biggest principles of pharmacology you need to know are medication safety and what kind of medications are used during an emergency. You also need to help with medication administration. You can help a patient self-administer medication. You can advise or assist in assisting medication with another rescuer or assist and administer medication to a patient. We're going to be reviewing the names, effects, actions, and indications and contraindications of different medicines and when to use them, when not to use them, and which ones to use, etc. Now, we're also going to be talking about complications, routes of administration, side effects, interactions with drugs they may already have on board or with some you've already administered, and dosages for medications administered. Medications are an important intervention available to use in EMT. Used appropriately, medications may alleviate pain and improve a patient's condition. Failure to administer medication safely and competently can lead to serious consequences for the patient, including death. As an EMT, you will administer medications, help patients self-administer medications, ask patients about medication use and allergies, report patient information to hospital personnel. It is essential that you have the knowledge and skills to administer or assist in administration of these medications. We're going to talk now about how medications work. And first, we're going to start with a couple of definitions. The first is pharmacology, which is the science of drugs, including their ingredients, preparation, uses, and actions on the body. Medication is a substance used to treat or prevent disease or relieve pain. Pharmacodynamics is the process by which medication works on the body. Different types of receptors are located throughout the body. These are sites on cells where medications or chemicals can bind and produce an effect. When medications are given, they bind to these sites and either stimulate the receptors to produce an effect or block the receptors to prevent other chemicals or medications from binding. A medication can either increase or decrease normal function of the body. An agonist is a medication that causes stimulation of receptors. An antagonist is a medication that binds to a receptor and blocks other medications or chemicals from attaching. A dose is the amount of medication that is given and depends on patient's weight, patient's age, and the desired action of the medication. Action is the therapeutic effect that a medication is expected to have on the body. It's also referred to as the desired effect or intended effect. And indicators are the reasons or conditions for which a particular medication is given. Contraindications are situations in which a medication would either harm the patient or have no positive effect. Absolute contraindications are situations in which a medication should never be given if the contraindication is present. Relative contraindication is a situation in which the benefit of administering the drug may outweigh the risks of side effects. And side effects are any action of a medication other than the desired ones. Unintended effects of side effects are effects that are undesirable, which pose little risk to the patient. Those are unintended effects. And untoward effects are effects that can be harmful to the patient. Now let's talk about some medication names. The generic name is a simple, clear, non-proprietary name. Generic names are not capitalized. Some medicines, like nitroglycerin, are often called by their generic name more than their trade name. The trade name is the brand name that a manufacturer gives to a drug. For example, Tylenol and Lasix. Trade names begin with a capital letter. One drug may often have more than one trade name because of multiple manufacturers. Prescription drugs are distributed only by pharmacists and require a physician's order. Over-the-counter or OTC drugs may be purchased directly without a prescription. Other kinds of drugs are recreational drugs like heroin or cocaine, herbal remedies, enhancement drugs, vitamin supplements. Any medication that a patient takes can be pharmacologically active and can cause an effect, so ask patients about any and all medications or drugs they're taking. It does include supplements. Routes of administration are enteral medications that enter the body through the digestive system. It's often in pill or liquid form, such as cough medicine, for example, and medications administered via this route tend to be absorbed slowly and are not commonly used in an emergency setting. Parenteral medications enter the body through some other means, often in liquid form administered through needles or syringes. These are absorbed more quickly and offer a more predictable and measurable response. Absorption is the process by which medications travel through body tissues to the bloodstream. Common routes of administration are PR, per rectum, which means by rectum. This is frequently used with children. It's easy to administer and provides reliable absorption. It's often used with medications for nausea and vomiting. Oral, which is PO, which means by mouth, enters the bloodstream through the digestive system. Can take as long as 1 hour for absorption to occur. The pros of this are that it's non-invasive, less expensive than parenteral medications or routes. The cons are that it's unpredictable because not all medication absorbs correctly. Absorption can be affected by upset stomach or diarrhea. Then you have also orally disintegrating tablets or ODTs. Those are put directly onto the tongue where they dissolve. Intravenous or IV injection, which means of course into the vein, is the fastest delivery but cannot be used for all medications. Intraosseous injections are into the bone. This reaches the bloodstream through the bone marrow. It requires drilling a needle into the outer layer of bone. This is painful and is often reserved for patients who are unconscious as a result of cardiac arrest or extreme shock. It's often used for children who have less available or difficult to access IV sites. Subcutaneous, SC, SQ, or sub-Q, it is abbreviated all three ways. Injection or subcutaneous injection means beneath the skin. The injection goes into the fatty tissue between the skin and muscle. Because there's less blood in these tissues than the muscles, SC medications are generally absorbed more slowly and have longer lasting effects. Some examples are daily insulin injections, some forms of epinephrine. Intramuscular or IM injection, which means of course into the muscle. It is usually absorbed quickly, but not all medications can be administered by IM route. Some examples are the EpiPen autoinjector, Mark I autoinjector. Some possible problems are damage to muscle tissue, uneven, unreliable absorption, especially in people with decreased tissue perfusion or who are in shock. Inhalation is breathed into the lungs, absorbed into the bloodstream quickly. This minimizes the effects of medication in other body tissues. Some forms are aerosols, fine powders, and sprays. Sublingual, which means under the tongue, enters through the oral mucosa under the tongue and is absorbed into the bloodstream within minutes. This is faster than the straight oral route and prevents medications and chemicals in the digestive system from attacking the effects of the medication. Some examples are like nitroglycerin tablets. Then you have subtranscutaneous or transdermal, which means through the skin. It's applied as a patch to the skin. It's longer lasting effect than other routes. Some examples are nicotine patch or nitroglycerin patch. Intranasal or IN is a relatively new format for delivery of medication. The medication is pushed through a mucosal atomizer device, or an MAD, that aerosolizes the liquid for delivery into the nostril. Liquid medication is aerosolized and administered into the nostril and provides quick absorption. Some examples are flu vaccine or naloxone. This table lists common routes of medication administration and rates of absorption. The form of a medication usually dictates the route of administration. For example, a tablet or spray cannot be given through a needle. The manufacturer chooses the form to ensure proper route of administration and timing of the medications released into the bloodstream, the effects on the target organs or body systems. Basic medication forms are tablets and capsules, solutions and suspensions, metered dose inhalers, topical medications, transcutaneous medications, gels, and gases for inhalation. With tablets and capsules, most medications given by mouth are in tablet or capsule form. Capsules are gelatin shells filled with powder or liquid medication. Tablets often contain other materials that are mixed with the medication and compressed. A medication that must be swallowed and digested provides a slower route of delivery and is less useful in an emergency. Solutions and suspensions. A solution is a liquid mixture of one or more substances that cannot be separated simply. A solution can be given almost by any route. When given by mouth, solutions may be absorbed from the stomach fairly quickly because the medication is already dissolved. Many solutions can be given as IV, IM, or SC injection. A suspension is a mixture of finely ground particles that are distributed evenly through a liquid by shaking or stirring, but do not dissolve. Suspensions separate if they stand or are filtered. It is important to shake or swirl a suspension before its administration. Usually it's administered by mouth, such as an antibiotic for pediatric patient or activated charcoal. Occasionally it's given rectally or applied directly to the skin, such as calamine lotion. It may be given via IM or SC injection, like hormone shots or vaccinations. Metered dose inhalers are liquids or solids that are broken into small enough droplets or particles that they may be inhaled. A spray canister directs such substances through the mouth and into the lungs and delivers the same amount of medication each time it's used. It's often used for respiratory illnesses such as asthma or emphysema. Topical medications include lotions, creams, and ointments, and these are applied to the skin surface and affect only that area. Lotions contain the most water and are absorbed rapidly. Ointments contain the least water and absorb slowly. Some examples are lotion would be calamine lotion, whereas an ointment would be a neosporin ointment. Transcutaneous medications are designed to be absorbed through the skin transcutaneously, also referred to as a transdermal medication. Unlike topical medications, which affect only the intended site, many transdermal medications have systemic or whole body effects. One example is nitroglycerin paste or an adhesive patch of nitroglycerin, nicotine, some pain medications, and some contraceptives. If you touch the medication with your skin, you will absorb it just like the patient. Gels are semi-liquids. These are administered in capsules or through plastic tubes. They usually have the consistency of pastes or creams but are transparent. One example is oral glucose for a patient with diabetes. Gases for inhalation are neither liquid or solid and are usually delivered through a non-rebreathing mask or nasal cannula. They're most often given in an operating room. The most common medication in gas form used outside the operating room is oxygen. Some general steps in administering medication. Medication should be administered only under authorization of online or offline medical direction. Medical control may inform you to administer medications offline or indirectly via protocols and standing orders. Online via telephone or radio. So follow the 6 rights. We'll cover those. Medication errors almost always result from failure to follow those 6 steps. So these are the 6 rights. 1, it's the right patient. Ensure the patient needs medication and is the person who receives the medication. 2 is the right medication. You verify the proper medication and prescription. 3 is the right dose. Verify the form and dose of medication. 4 is the right route. Verify the route of the medication. And the right time is number 5. Check the expiration date and condition of the medication. And 6 is right documentation. Document your actions and the patient's response. Medication administration and the EMT. Your unit may carry oxygen, oral glucose, activated charcoal, aspirin, and epinephrine. You may give these medications only according to standing orders in a protocol or a direct order. Over the years, EMTs have been allowed increasing responsibility to work with medications. Many departments have strict guidelines on when an EMT is allowed to administer a medication. The circumstances are peer-assisted administration. In other words, you administer a medication to yourself or your partner. Or B, you were exposed to a toxic agent. Typically, an auto-injector form. Patient-assisted administration is where you assist the patient with administering his or her own medication. Example would be nitroglycerin, EpiPen, auto-injectors, or MDI bronchodilators. EMT-administered administrations are EMT directly administers the medication to the patient. The patient may be severely confused or unable to understand the need for the medication. Some examples would be oxygen, oral glucose, activated charcoal, nitroglycerin, or aspirin. The medication itself does not necessarily dictate whether you'll be assisting with its administration or actually administering the drug. Medical controls, state guidelines, and local protocols determine which medications an EMT in your system may administer. Refer to your local standards to obtain a listing of how and when EMTs can administer medication. Medications used by EMTs. The state department and medical director will define which medications are carried in your ambulance. The 2009 National EMS Standards recognize that some regions of the country may need EMTs involved in the administering of additional medications aside from oxygen, glucose, charcoal, aspirin, and epinephrine. Some examples would be acetaminophen, ibuprofen, or diphenhydramine. With oral medications, the considerations are the advantages, ease of access, and comfort level. Disadvantages are that the digestive tract can be readily affected by food stress and illness, and the spread of movement of food through the tract dramatically changes the speed of absorption. Follow these steps to perform oral medication administration. First, take standard precautions, confirm the medication is not expired, and obtain medical direction per local protocol. Confirm that the patient has a patent airway and is able to swallow, and then instruct the patient to swallow or chew the medication, and then monitor the patient's condition and document. With activated charcoal, many poisonings involve overdoses taken by mouth. Activated charcoal reduces the amount of medication being absorbed in the body by binding the drug to its surface absorption. Activated charcoal is ground into a very fine powder to provide the greatest surface area for binding. If allowed by local protocol, you will carry a container with premixed suspension of activated charcoal and powder and water. Activated charcoal is frequently suspended with sorbitol, which is a sugar, and has a laxative effect that causes medications in the charcoal to move quickly through the digestive system. It's administered by mouth and may be unappealing to patients, so use a covered container and ask the patient to drink the fluid through a straw. It may stain, so use protective clothing over your uniform and protect the patient's clothing. And this should not be given to patients who have an altered level of consciousness or a risk of aspiration. Also, patients who have ingested an acid, alkali, or petroleum product. Oral glucose. Glucose is a sugar that cells use for energy. It is necessary for brain cell survival. With hypoglycemia, this is defined as an extremely low blood glucose and can be caused by an excess of insulin. Oral glucose can counteract the effects of hypoglycemia. An EMT can give glucose only by mouth. It's available as a gel designed to be spread on the mucous membranes between the cheek and gum. It's not as quick as injections for hospital personnel, AEMTs, and paramedics that they use. And what is also available are glucose tablets. Never administer oral medications to an unconscious patient or a patient who is unable to swallow so that you can protect the airway. Aspirin. The purposes of aspirin are that it is an antipyretic, which reduces fever, analgesic, which reduces pain, and an anti-inflammatory, which reduces inflammation. It inhibits platelet aggregation, which is clumping, which is useful during a potential heart attack. Contraindications are hypersensitivity to aspirin or pre-existing liver damage, bleeding disorders, and asthma. It should never be given to children because of the possibility of Rye syndrome. Sublingual medications. Considerations for use of sublinguals are that the advantages are that it's easy to take or easy to talk with awake and alert patients and advise them to place a pill under their tongue. The head and face receive large amounts of blood flow, so absorption rates are relatively quick. Disadvantages are that any medication placed in the mouth requires constant evaluation of the airway, and you must also be alert to any signs of choking on the pill, and it should not be used if the patient is uncooperative or unconscious. Nitroglycerin. Many cardiac patients carry fast-acting nitroglycerin to relieve angina or angina pain. Nitroglycerin increases blood flow by relieving the spasms and causing arteries to dilate by relaxing the muscles of the coronary arteries and veins. It also relaxes veins throughout the body so that less blood is returned to the heart, which decreases workload and blood pressure. Before administration, check blood pressure before you administer any nitroglycerin. If the systolic blood pressure is less than 100 milligrams of mercury, nitroglycerin will have a harmful effect. Even a patient who has adequate blood pressure should sit or lie down with the head elevated before taking this medication in case there is fainting or syncope. If a significant drop in blood pressure occurs and the patient feels dizzy or sick, lay the patient down. Obtain orders or follow your local protocol to administer nitroglycerin. If nitroglycerin no longer brings relief to a person for whom it has previously worked, the person may be experiencing an MI instead of an angina attack. Ask how much nitroglycerin the patient needed in the past to relieve pain and how much was taken this time, and report this information to medical control. You can have nitroglycerin can have potentially fatal interactions with erectile dysfunction or ED medications taken within the past 24 hours, such as Viagra, Cialis, and Levitra. Drugs for erectile dysfunction may be used by both men and women. The effects are it relaxes the muscular walls of coronary arteries and veins and results in less blood returning to the heart, decreases blood pressure, relaxes arteries throughout the body, and often causes a mild headache and or burning under the tongue after administration. Administration by tablet. This is usually a sublingual medication. Place the tablet under the tongue where it dissolves. The patient should experience a slight tingling or burning sensation. If not, the medication may have lost its potency because of aging or improper storage. Be sure to check the expiration date on the bottle. Nitroglycerin should be stored in its original glass container with the cap screwed on tightly. What looks like cotton in the container is actually rayon. Real cotton in the container can absorb nitroglycerin, reducing its potency. Do not place other medications in the container. Avoid exposure to light, heat, or air. Note any drug concerns or drug storage concerns in the patient's medical history. And administration by metered dose spray of nitroglycerin are deposits medication on or under the tongue. One spray equals one tablet, and do not use a spacer with a metered dose canister. Administration considerations for tablet and spray of nitroglycerin are to wait 5 minutes for a response before repeating the dose. Closely monitor the patient's vital signs, particularly the blood pressure, and give repeated doses per medical control and or local protocol. Always wear gloves because the medication can be absorbed through your skin. Reconfirm that the medication is still indicated for the patient, and know and understand your local protocols. Intramuscular medications. Considerations are the following. Advantages are that it provides quick and easy access to the circulatory system without a need for placing a needle into the vein. And blood flow to the muscle is relatively stable even during circumstances of severe illness or injury. Disadvantages are that there's use of a needle and subsequent pain. Patients may fear pain or injury. With epinephrine or adrenaline, is the main hormone that controls the body's fight or flight response. A primary medication that an EMT will deliver IM, and it is sympathomimetic, and in other words, it mimics the effect of the sympathetic nervous system. Released inside the body when there is sudden stress, and it's also known as adrenaline. The effects are that it increases heart rate, constricts blood flow or blood vessels, causing increased blood pressure, and dilates passages in the lungs, eases breathing problems and asthma or allergic reactions, and it may maintain blood pressure and an allergic reaction. It should not be given patients who have hypertension, are experiencing hypothermia, experiencing MI, or do not show signs of wheezing or airway obstruction due to an allergic reaction. Administering epinephrine by injection, which is permitted in some states, is used to treat life-threatening anaphylaxis. To treat life-threatening anaphylaxis, the result of life-threatening anaphylaxis can come from insect venoms or other allergens that cause the body to over-release histamine. Over-release of histamine may reduce blood pressure, cause wheezing from bronchial spasms and swelling of the airway tissues, which is edema, may make it difficult for the patient to breathe. Epinephrine acts as a specific antidote to reverse the effects of histamines by constricting the blood vessels, allowing blood pressure to rise, reducing swelling, and it also is dilation of the air passages to increase flow of air. Epinephrine may be dispensed from an auto-injector and automatically delivers a preset amount of the medication, which is usually 0.3 micrograms or milligrams, 0.3 milligrams. And the side effects are that it causes a burning sensation where it's injected, increases heart rate. Some services do not permit EMTs to carry epinephrine, but do allow them to assist patients in administering their own epinephrine. Now with naloxone, you want to administer, if you're administering naloxone by injection, it's used to reverse the effects of opioid overdose, and it can be administered by family members or caregivers to help reverse dangerous side effects of opioid overdose, such as life-threatening respiratory depression. The important considerations are that you need to consult medical direction to determine if EMTs are allowed to administer naloxone in your region. Always follow the local protocol and its means of administering it to the patient. Consider requesting ALS assistance and find out if naloxone has been administered by a bystander prior to your arrival. The effects of naloxone may not last as long as those of opioids, so repeat doses may be necessary, and it can cause severe withdrawal symptoms, including seizures and cardiac arrest. So consider your safety, as the patients may become violent following naloxone administration. Begin administering naloxone in increments of 0.4 milligrams, then gradually increase based on the patient's response or lack thereof. Intranasal medications. If you're injecting naloxone through intranasal, not all EMS departments use naloxone autoinjectors due to their expense. So the most common technique for naloxone administration is via the intranasal route. Other common routes of administration include intravenous and intramuscular. The same considerations listed for administering injectable naloxone apply when administering naloxone in any other form. The steps to administer the medication intranasally are obtain medical direction per the local protocol, confirm the correct medication and expiration date, and attempt to determine if the patient is allergic to any medications. Prepare the medication and attach the atomizer. Never use a needle. Place the atomizer in one nostril, pointing up and slightly outward. Administer a half dose, which is 1 milliliter maximum, into each nostril. Reassess the patient and document appropriately. If you do not have naloxone available, note that BVM ventilations provide necessary treatment to opioid overdose patients until definitive care can be reached. Now for inhalation medications, your one you're going to carry is oxygen, and it is by far the most commonly administered medication in a pre-hospital setting. All cells, especially those in the heart and brain, need oxygen to function properly. So oxygen should be administered when a patient is not breathing or they're having trouble getting air. It's generally administered via a non-rebreathing mask at 10 to 15 liters per minute. This is the preferred method and can provide up to 90% inspired oxygen. It can also be administered via nasal cannula at 2 to 6 liters per minute for patients who cannot tolerate a non-rebreathing mask. Oxygen flows through two small tube-like prongs in a nasal cannula that fit into the patient's nostril and can provide up to 44% inspired oxygen if the flow meter is set at 6 liters per minute. It must also provide artificial ventilations if the patient is not breathing, using a BVM at least 15 liters per minute. Ensure that there are no open flames, lit cigarettes, or sparks in the area in which you are administering oxygen. Metered dose inhalers and nebulizers. These are used to administer liquid medications that have been turned into a fine mist by flow of air or oxygen. The medication is atomized, breathed into the lungs, and delivered to the alveoli. Advantages are that the blood flow to the alveoli is very high, and absorption rates are close to those found with IV medications. It's fast and relatively easy route to access, and is commonly used because of convenience and portability. Disadvantages are that the patient needs to be cooperative and be able to control their own breathing. Cannot be used for an unconscious patient. An EMT should use a nebulizer for severe problems. Medication administered using an MDI or small volume nebulizer can also be done, and these are used for respiratory conditions that are not severe enough to require epinephrine. Some chemical cousins of epinephrine are more narrowly focused on the lungs. These are delivered with an MDI or SVN. An MDI requires a great deal of coordination to administer, and it may be difficult to achieve when a person is having trouble breathing. Patients must aim properly and spray just enough as they start to inhale, or spray just as they start to inhale. Use spacer adapters to avoid spray misdirection. A spacer fits over the inhaler like a sleeve and has an opening for the inhaler at one end and a mouthpiece on the other end. The patient sprays the prescribed dose into the chamber and then breathes in and out of the mouthpiece until the mist is completely inhaled. Spacer devices are especially useful with young children who have difficulty experiencing use with an MDI. SVNs are much easier to use than MDIs. They do take longer to deliver the medication, require an external air or oxygen source. An SVN can be more effective than an MDI in patients with moderate to severe respiratory distress, and it can be used while the patient is on CPAP and during BVM ventilation as well. It can easily be placed into a non-rebreathing mask. And assisting a patient with an SVN, make sure you get medical direction per local protocol, confirm the correct medication and expiration date, confirm the patient is not allergic to the medication, add the appropriate medication, and close the nebulizer reservoir and assemble the device according to the manufacturer's instructions. Connect the nebulizer machine or oxygen tank at 6 to 8 liters per minute. Place the nebulizer in the patient's mouth and instruct the patient to breathe until the medication is gone, which is usually about 5 minutes. Reassess the patient and document appropriately. Some patients use quote-unquote rescue inhaler MDIs to relieve bronchial spasms quickly. Some examples are Primatene Mist, Bronitine Mist, Bronkaid Mist. These are cousins of epinephrine that produce fewer side effects. They act more specifically than epinephrine on the on the bronchi of the lungs, causing dilation with lesser effect on the heart. Some examples are metroaprinon, which is Alpuent or Metropel, albuterol, which is Proventil or Ventolin, and respiratory patients may also use a maintenance or control inhaler. These are slow-acting and meant to be taken regularly, and they're not useful for a patient suffering acute respiratory distress. Some examples of those would be like Flovent Discus or Pulmicort Asmanex or Qvar, Alesco, and these patients may be prescribed several types of MDIs at once. There are dozens of different MDIs available, and the only medication that will be effective during an acute attack of shortness of breath will be a fast-acting rescue inhaler like albuterol, which is Proventil or Ventolin. Make sure you always have the right medication for a patient with acute respiratory distress. Patient assessment includes finding out which medications the patient is currently taking. This information may provide vital clues to the patient's condition. It may help guide your treatment and may be extremely useful to the emergency department physician. It can also help you determine a chronic or underlying condition when a patient is unable to relate his or her medical history. Discover what the patient takes and transport the medications or a list of them with the patient to the emergency department. Ask about the use of any non-prescription drugs like over-the-counter, herbal supplements, or illegal drugs. A medication error is an inappropriate use of a medication that could lead to patient harm. This could include incorrect communication of a dose or administration of an incorrect dose. Rules-based error is an administration of a medication that is outside one's scope of practice. Knowledge-based error is choosing the wrong medication to administer. Skills-based error is using an incorrect equipment or incorrect procedure for administering a medication. If the circumstances of medication errors are understood, it may be possible to minimize them. Ensure that the environment does not contribute to errors. So make sure you have sufficient lighting, organize equipment well, limit distractions as much as possible, and consider using a cheat sheet to help yourself remember all crucial steps to medication administration. Always stop to ask yourself, why am I doing this? If a medication error does take place, rapidly provide appropriate patient care that is required. Notify medical control as quickly as possible. Follow your local protocols, and then document the incident thoroughly, accurately, and honestly. Talk with your partner, supervisor, or medical director. This provides opportunities to learn and identify areas to target during quality improvement. Okay, class, let's go over the review questions for pharmacology. So the first question is, pharmacology is defined as A, the study of cells and tissues, B, the study of drugs and medications, C, the effects of medications in the lungs, and D, the distribution of drugs to the body's tissues. This one should be pretty easy. And it is, of course, B. Pharmacology is the field of science that deals with the study of drugs and medication. A is incorrect because study of cells and tissues is physiology, and that's a branch of biology. B, of course, is the correct answer. C is incorrect because the effects of medication in the lungs is pharmacodynamics, which is a different word altogether, and that is the processes of the body's response to medications. And D, distribution of drugs to the body's tissue, that's incorrect because that is another definition, that is pharmacokinetics, which is the study of medication distribution within the body. Number 2, which of the following statements regarding medications is false? A, many medications are known by different names. B, some medications affect more than one body system. C, over-the-counter drugs must be prescribed by a physician. Or D, EMTs should ask about any herbal remedies or vitamins that the patient may be taking. This one should be a no-brainer. Okay? And the answer is, of course, C. Over-the-counter drugs mean just that. They're over-the-counter, like Tylenol and Motrin, and do not require a physician prescription. They can be purchased at a supermarket or drugstore, and most medications have a generic name and a trade name. Like acetaminophen is the generic name for Tylenol, and ibuprofen is the generic name for Motrin. Because all these other statements are true, and we covered the one that's false, I'm not going to review the ones that were incorrect. A and C and B and D. So all of them are correct except for C. And you can see right here, over-the-counter drugs must be prescribed by a physician. That is definitely false. Question 3, which of the following routes of medication administration has the fastest effect? oral, intravenous, subcutaneous, or intramuscular. This one should be pretty easy also. And it is, of course, IV. Because it is administration directly into a vein, a drug given intravenously enters the body quickly. The intravenous route is the fastest acting of all routes of medication administration. So let's look at the other answers. A, oral. The medication must be absorbed through the mucous membranes first to get to the circulatory system. So that's not the fastest, although it is faster than some. Intravenous is, of course, the correct answer. Subcutaneous, that's incorrect because medication must pass through layers of skin before reaching the circulatory system. Because remember, the fatty layer of skin doesn't have very many blood vessels in it. And then intramuscular is the medication needs to travel through the entire circulatory system. It's not as quick as IV. Number 4, when administered to a patient, a metered dose inhaler, or an MDI, will A, deliver the same dose each time it's administered, B, be ineffective when given to patients with asthma, C, deliver a different dose each time it's administered, or D, be delivered to the lungs over a period of 6 to 8 hours. Let's look at the correct answer. And it is A. The metered dose inhaler, MDI, delivers the same dose of medication each time it's used. Drugs given via the MDI act very quickly and are commonly prescribed for patients with asthma, emphysema, and other airway diseases. Let's look at our incorrect answers. When administered to a patient, a metered dose inhaler will be ineffective when given to patients with asthma. Yeah, this is incorrect because an inhaler is usually provided, a different kind of inhaler is usually prescribed for patients with asthma. It's more of a, use as you need it rather than metered dose. C, deliver a different dose each time it's administered. Well, if it's metered, it can't give you anything but the dose that it's metered to. So C is incorrect. And D, be delivered to the lungs over a period of 6 to 8 hours. And that is incorrect because the medication is delivered straight to the lungs almost immediately because it's inhaled. Number 5, you are managing a 62-year-old woman who complains of crushing chest pain. Her blood pressure is 84/64 millimeters of mercury, and her heart rate is 110 beats per minute. Medical control advises you to assist her in taking prescribed nitroglycerin. After receiving this order, you should A, reassess the patient's heart rate and then assist with nitroglycerin. B, repeat the patient's blood pressure to the physician and confirm the order. C, wait 10 minutes, reassess the blood pressure, then give the nitroglycerin. Or D, administer the nitroglycerin to the patient and then reassess her blood pressure. If you are reading this carefully, you'll get this one correct without terribly much effort. And it is B. Nitroglycerin is a vasodilator and lowers blood pressure. Therefore, it should not be given to patients with a systolic blood pressure less than 100 millimeters of mercury. If you receive an order to give nitroglycerin to a patient with a systolic BP of less than 100 millimeters of mercury, you should ensure that the physician is aware of the patient's BP and reaffirm the order. So let's look at the incorrect answers. You're managing a 62-year-old woman who complains of crushing chest pain. Her blood pressure is 84/64 and her heart rate is 110. Medical control advises you to assist her in taking her prescribed nitroglycerin. After receiving this order, you should, let's look at A, reassess the patient's heart rate, then assist with nitroglycerin. No. Administration of nitroglycerin is based on blood pressure, not on the heart rate. B, because her blood pressure is so low, you want to repeat that blood pressure to the physician and confirm the order, because at that point, it's on him, not you. This is why we have medical control and why you need to make sure you know how to access it live in a situation like this, because he might not have heard you right. So that's B is the correct answer. C, wait 10 minutes, reassess the blood pressure and give nitroglycerin. No. You need to also make sure that the physician's aware of the blood pressure and reconfirm the order. Waiting 10 minutes with somebody whose blood pressure is that low with a heart rate that high could have catastrophic results. And D, administer the nitroglycerin to the patient, then reassess her blood pressure. Nitroglycerin is a vasodilator. Her blood pressure is 84/64, which is already really low. So this medication should not be given to patients with a systolic blood pressure of less than 100 millimeters of mercury. Okay, and in this case, her systolic is only 84. Okay, 6. Activated charcoal is indicated for patients who have ingested certain drugs and toxins because it A, acts as a direct reversal agent for most medications, B, induces vomiting before the chemical can be digested, C, detoxifies the drug before it can cause harm to the patient, or B, binds chemicals in the stomach and delays absorption. This one should be pretty easy too. And it is, of course, D. Activated charcoal is an adsorbent. That is, it binds to harmful chemicals that have been ingested. This binding effect delays digestion and absorption of the chemical by the body. So let's look at the incorrect answers. A, activated charcoal acts as a direct reversal agent for medications. It's not a reverse agent. It binds with other chemicals. B, so A is incorrect. B, induces vomiting before the chemical can be digested. This is not the medication to induce vomiting. And depending on what they took, vomiting could have catastrophic results, and charcoal can mitigate that. No, B is incorrect. C, detoxifies the drug before it causes harm to the patient. Well, it doesn't really detoxify it, it simply binds it up, delays absorption into the body. So it doesn't negate the presence of the chemical, it just absorbs it and prevents it from getting into the digestive system. And then, of course, D is the correct answer. 7. With regard to pharmacology, the term action refers to A, the ability of a drug to cause harm, B, the ability of a drug to produce side effects, C, the amount of time it will take the drug to work, or D, the expected effect of a drug on a patient's body. This one should be straightforward also. And it is, of course, D. As it applies to pharmacology, the term action refers to the effect that a drug is expected to have on a patient's body. Prior to administering any drug, the EMT must be aware of its action or actions on the body. So let's look at our incorrect answers. A, the ability of a drug to cause harm. That's not the definition of action. That's the definition of contraindication. B, the ability of a drug to produce side effects. That is not correct because this is any action of a medication other than the desired ones. C, the amount of time it will take the drug to work. That's the onset of action. In other words, it takes 35, 45 minutes before it actually starts to have an effect on the entire organism or the entire body. And then, of course, D is the correct answer. Action is the expected effect of a drug on the patient's body. 8. Which of the following patients is the best candidate for oral glucose? A, a conscious patient who's showing signs of hypoglycemia. B, unconscious diabetic patient with documented low blood sugar. C, conscious diabetic patient suspected of being hyperglycemic. Read your words carefully here. And D, semi-conscious patient with signs and symptoms of low blood sugar. And it is, of course, A. Oral glucose is only given to someone who's awake, cooperative, with an open patent airway. So it's given to diabetic patients with suspected or documented hypoglycemia or low blood sugar. It should not be given to unconscious patients or those who are otherwise unable to swallow it because it may be aspirated into the lungs. So our incorrect answers, A is of course correct. B, unconscious diabetic with documented low blood sugar. No, because oral glucose shouldn't be given to someone who's unconscious. C, conscious diabetic patient suspected of being hyperglycemic. Hyper means too much sugar, so if you give them glucose, you're just going to give them even higher blood sugar. So that's why you have to measure their blood sugar. So yeah, that would be incorrect. D, semi-conscious patient with signs and symptoms of low blood sugar. Again, if they're semi-conscious, they may become unconscious. And if they're semi-conscious, even, they may not be really aware of what's going on. So they could aspirate it into their lungs. 9. Epinephrine is given to patients with anaphylactic shock because of its effects of A, bronchodilation and vasodilation, B, bronchodilation and vasoconstriction, C, vasodilation and bronchoconstriction, or D, bronchoconstriction and vasoconstriction. Remember what epinephrine does, and then look at these options and read it carefully, and I'm sure you'll get it right. It is B. The two major complications with anaphylactic shock are bronchoconstriction, which impairs air movement in and out of the lungs, and vasodilation, which causes a drop in blood pressure. So the epinephrine reverses these processes by causing bronchodilation and vasoconstriction, stabilizing the patient and improving breathing and increasing blood pressure respectively. So the first thing that's going to happen is open up the airways and then cause vasoconstriction. So our incorrect answers: A, I'll reread the question. Epinephrine is given to patients with anaphylactic shock because of its effects of A, bronchodilation and vasodilation. That's not correct. Epinephrine dilates the bronchi but constricts the circulatory system. B is, of course, the correct answer. C, vasodilation and bronchoconstriction. Again, epinephrine constricts the circulatory system and dilates the bronchi. And so that's incorrect. And D, bronchoconstriction and vasoconstriction. That's not correct because epinephrine dilates the bronchi and constricts the circulatory system. Number 10, the process by which medications travel through body tissues until they reach the bloodstream is called A, adsorption, B, onset of action, C, absorption, or D, transformation. And it is C. The process by which medications travel through body tissues until they reach the bloodstream is called absorption. Adsorption, adsorption, refers to the binding of one chemical to another. Activated charcoal delays absorption of certain chemicals into the bloodstream because it adsorbs or binds to them in the stomach. One of those difficulties of the English language. So make sure you're reading your words carefully and saying them correctly when speaking in proper terminology to your coworkers and or other personnel and hospital personnel. So let's look at the incorrect answers. The process by which medications travel through body tissues until they reach the bloodstream is called A, adsorption. And that's incorrect because in adsorption, particles bind to a surface, like a chemical in the stomach binding to activated charcoal. B, onset of action. That's incorrect because onset of action is the time that it takes for a medication to start doing what it is prescribed for, and we just covered that a couple questions ago. C, absorption, and with an AB, and that's the correct answer. That's the process by which medications travel through tissues until they reach the bloodstream. And then D, transformation. That's incorrect because it has nothing to do with medication administration whatsoever. So class, thank you for your time and attention. Please make sure that you, when documenting anything with medication, that you follow the 6 steps. Take all the appropriate care to have things documented thoroughly. Make sure you aren't exercising outside of the limits of your license, and make sure that you are writing clear and precise using clear and precise technical language when speaking with medical director, maybe in the field, or with other rescuers, etc. Thank you for your attention, and we'll see you in the next class.